Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink, and welcome to Helping Seniors Television. On behalf of our president and founder, Joe Steckler, and our entire Helping Seniors team, welcome to today's edition of Helping Seniors TV. And we have the pleasure of having with us on the program today, long time friend of Helping Seniors. In fact, Dr. Lee Sheldon goes back with Joe pre-Helping Seniors days, don't you?
Yeah, Joe and I go back to the time when I had a TV show.
I think he was a guest on my TV. You started Joe in the TV business.
Maybe I did. But since then, Joe has far surpassed everything we've done.
You know, I had this conversation with John Harper on the radio that John had named him the longest running radio personality in Florida, talk radio in our area, because I guess you guys have all worked together with Joe back when he was building up the Brevard Alzheimer's Foundation and creating the Joe's Clubs. And here we are 10 years later on the Helping Seniors front.
Here we are, yeah. And
Joe is 86, and even though it takes a knocking, he just keeps on rocking. He's like the county's best advocate for seniors that there is.
Absolutely, yeah, yes.
So I'm excited about today's topic, and it's kind of an interesting topic to talk with a person that has made a career out of helping people with dental implants. But today our program is actually saying, why would we skip over dental implants? It sounds like reverse psychology or something.
I'm just trying to put myself out of business, Kerry. What can I say? So here's our opportunity to say, we're done. No more dental implants. That's not really true. Right. But at the same time, dental implants are oversold. They just are oversold. There are too many people getting dental implants, too many people getting dental implants for the wrong reasons, and too many people, including dentists, not giving the option of saving teeth. We've come full circle. You know, in 1986, I put in my first implant. May 16th, 1986, a red letter day for me. I didn't sleep the night before. All dental implants at that point were the same length. I had to cut the implant in front of the patient at the correct length, re-sterilize it in order to be able to put it in. I mean, it was work to do a dental implant at that time. And at that time, we were saying, I'm wondering if this is going to work or not. The research said it would, yeah. But we were at that point. It was new. Yeah. Then it's come all the way where people think dental implants are better than teeth. You know what? Yeah. In some cases they are, and in some cases they're not. I'm really concerned. I'm a periodontist. I save teeth. And so we're treating gum disease. We also do dental implants. The endodontist also saves teeth, does root canals. And we're getting this idea that we don't need to save teeth, that dental implants are easy and they last for a lifetime. And the answer is they don't always last for a lifetime. If I had something go wrong with a dental implant, or had something go wrong with a tooth, things go wrong. I'm not going to talk about it. Things go right. Things go wrong. And when things go wrong, it's easier for me to repair a tooth than it is for me to repair a dental implant.
You know, you never hear this. I was making the comment before the cameras were rolling. I said, we'll sit at home and we'll watch these TV commercials, and they just make it sound so simple. It's just you'll get all this stuff back, and certainly maybe the results are beautiful, but they never tell you, you know, as a consumer, I may be naive, but I am not naive enough that I don't understand that everything is, you're kind of balancing out your choices, right? So if I choose this, there's a plus, and there might be something. I at least want to know what all the things are, so I'm making an educated decision.
It's correct, and I think one of the things, because TV has brought patients into my office, even though we don't advertise on TV anymore. Most everybody that you see here has gotten our magazine or has been watching us, but and of course we're going to extol the virtues of dental implants, because what is the purpose of marketing? The purpose of marketing is to get somebody into your office.
Sure.
But once the person comes into the office, then what? Then what? And if you look at some of the centers, in fact most of the centers, people come in with one purpose. They come in, I'm sick of my teeth. I can't stand going through this. There's been multiple failures. Let's take them out. Let's put in dental implants. It's very much like the denture clinic was. We still have denture clinics now. Denture clinics were 30, 40 years ago. I'm sick of my teeth. Pull out the teeth. Put in dentures, okay? Well, this is a very expensive denture. It is. And we do an awful lot of full mouth dental implant work. Don't get me wrong. I mean, we do it. But to be able to go into an office and be able to see the options, one side saving teeth, one side not saving teeth and extracting with dental implants, may be more important to that patient than just the patient coming in with the conclusion, without diagnosis, that this is all that can be done, and they take out teeth and put in dental implants. So we've got to look at this. We've got to say that, in fact, teeth get diseases, just like every other part of the body gets diseases. And amputation is not necessarily the only answer to that disease.
You know, the question that you're raising, and it makes you think about it, because, you know, a lot of times when you see these ads, these national ads, and they're talking about, oh, just go in here, it's so easy, blah, blah, blah. And you have to ask yourself a question. If you're going in there, you are actually sort of, to some degree, probably trying to self-diagnose and say, well, this is what I need. And maybe there's a better way to approach it than just a wholesale yank them out and put those in.
There is. And that doesn't mean we don't do wholesale yank them out and put them in. I mean, we do. I mean, there are times when things have just gone too far. But there are also times when we reach a conclusion without diagnostic evidence. And I'll give you a couple of examples.
Sure.
Within my own profession, and shame on me for indicting my own profession, but I'm 70 years old, I'll say whatever I want. You know, so if you go and you see your dentist and the dentist says you have periodontal disease, I'm going to have my hygienist treat you. And then the hygienist has been treating over 2 or 3 or 4 years, and the periodontal pockets still aren't resolving, the conclusion might be reached, you've got periodontal disease, there's nothing that can be done. Or the other conclusion might be, you have periodontal disease, I don't know what else to do. You know, if you have heart disease and you're seeing your general physician, what happens? The general physician will do what the general physician can do, and then when it doesn't work, where do they go? To the cardiologist. Well, if you have periodontal disease and we've done everything we can within the general dentist's office, what's the answer? Is it extract the tooth? Or is it, I'm going to refer you to a periodontist to see what he or she can do?
Right.
There isn't enough of that going on.
You know, you talked at one time, because in addition to your own, I guess I would say, well-deserved acclaim as a top periodontist in the area, I've seen you over the years also train other periodontal practices and dentistry practices around the country on how to do dentistry with excellence. And I remember one of the things that you've said along the way is that in the older days, you would see a lot of referrals from dentists, and but now necessarily the dentists, and you've explained this too, dentists sometimes put out there that they can do things that they might be better leaving to a specialist.
I think so. I mean, it doesn't mean that general dentists aren't qualified to do a lot of things. They are. And just as in every profession, there are better people and not so good people, okay? And so you've got to look at that. I think if we're looking at a particular specialty, let's say endodontics, generally speaking, you're going to get a real good root canal done by a root canal specialist. And just because the dentist says, I can do that, doesn't necessarily translate into, I'm the best person to do that. So, you know, I'll concentrate on root canals, even though I've never done a root canal in my life. Since dental school, I haven't done a root canal.
I was going to mention that. I was so surprised. We had done a radio show, and you mentioned that you routinely will refer somebody out to an expert for root canal. And, you know, as an average consumer, we just think we're going to the dentist. We don't understand all these differentiations.
It's a discipline. And the person who's doing it every day has the technical expertise to do it well, often has technology that wouldn't be available otherwise. Within root canal specialties right now, Just as you've seen CT scans in our office, they use CT scans too. They'll use a surgical microscope in order to be able to find the canals, because sometimes a tooth that's supposed to have 3 canals might have 5 canals. The only way you can see it is with a microscope. Sometimes it's difficult to get into a canal, and the person who's the endodontist will have the facility to get into the canal and take care of that, rather than it can't be done. I can't do it, and the endodontist might very well be the person to say, I can do it, and does do it.
You know, I was thinking about this because I was thinking about our own president and founder's experience with a knee replacement that he had done. And I remember he was telling me before he elected to go forward with that, Joe had asked the surgeon, he said, well, how many of these do you do? And it was like, the number was something crazy, like 700 a year. And I was thinking, like, you really would want to go to somebody that is performing this type of work, because they're going to be very familiar. There won't be any surprises. They have run into so many things over such a period of time. And I wanted to ask you, because we talk about, you know, somebody comes into the office, and as a consumer, we just know we have a problem. We're not trained to know what is causing it. And one of the things that I've heard you talk about over and over is the importance of proper diagnosis, so that you really understand and you're not just chasing ghosts of a problem.
It's true. In fact, I just had a problem this week. A patient of mine came in and had a problem. I consider myself a pretty good diagnostician. Whether I am or not, who knows, but I consider myself to be a pretty good diagnostician. I looked at it, the patient said, I've got a problem, and I think it's in my gum. And I went and I did all of the testing that I did, and I wasn't sure. Wow. So I wanted to get the endodontist's opinion. Now, just because you go to an endodontist doesn't necessarily mean you're going to have a root canal done. You go to an endodontist, the endodontist is great at doing root canals, but the endodontist is better than I am at testing people to determine whether the root canal is necessary. So I upload the CT scan to him. I upload the x-rays to him. I had done some pretty fancy diagnostics for me, and still it wasn't conclusive to me. So I said, here's what I see. I want to know what you see. Let's get an independent opinion. He sees the patient that day or the next day, says, no, it's gum. It's not endodontic. I said, all right, now I have, now I've gotten who I feel is an expert to look at it. Now I feel better about going in and doing the surgical procedure that we need to do in order to be able to handle this problem. You
know, one of the things that reminds me is there's folks, Dr. Sheldon, as we talked about early in the show, has had so much experience. He's been with Joe and the Helping Seniors team since the day the organization was open. And there's a wealth of TV programs that you and Joe have done. We've done a few. But over the years, there's some tremendous TV programs. And I remember one in particular you did with Joe called The Value of a Second Opinion. And it's so interesting to hear, here you are, who is an expert at this, and you're calling for that second opinion.
I am, and he's 20 years younger than I am.
So when we see these commercials about how great dental implants are, and you know, you go into a grocery store around here, and probably you're going to see, or maybe open up your mailbox, and here's a thing where you've got you with Dr. Matthew Sheldon and Dr. Michelle Furtado, and you guys look great on the cover, and you're talking about, we want to help your smile. So I get all that, but how do you decide when somebody comes in what's the best course for them?
I think for most of the people we're going to see are patients who have periodontal disease or severe decay, and we've got to make the decision as to whether the tooth can be saved or not. For many of our patients who have advanced periodontal disease, which is what we see, and they've been told they need to have their teeth taken out, before we'll go too far into treatment, I'll have the patient spit into a cup and send out a saliva sample out to a laboratory in Minnesota so we can better identify which bacteria are there.
Wow.
So because we know which bacteria are aggressive and which bacteria are not.
Right.
And you figure you don't want to have aggressive bacteria, and you don't. But if you do have aggressive bacteria and you do the right treatment, which doesn't necessarily have to be surgical, it may be antibiotic and good non-surgical therapy, you get rid of that bacteria, bone grows back on teeth.
Wow.
So in periodontal disease, that's known as being pockets and bone loss. Pockets meaning you're probing down below the gum line, and you hear something like 5 or 7 or 8 or that type of thing. We can see that without even doing any surgical treatment, we can get those 5, 7, or 8 to go down to 3 and 4. Simply by getting the correct diagnosis, using the correct antibiotic, and then doing the correct treatment of the root surface, and people will heal. That's what's neat.
So I'm asking this question then, is that actually an argument that gives you a reason to think about the benefit of natural teeth versus implants? Because does bone growth happen around an implant?
Bone growth won't. It will happen as a result of a bone graft. So, at the time of the extraction, we have an implant that is size 3, but the socket may be size 5. Okay. So we have to fill in the gap between size 3 and size 5 in order to be able to get that implant integrated properly. And we don't always have to do that, but very often we do. So we can grow bone back in that direction. If we have a jaw that's too thin, we can do a bone graft to make the jaw thicker in order to be able to get a dental implant. Sometimes it's too thin for a dental implant to put in. So we can do that. But on the other side, if you have a diseased tooth, very often, if you get rid of the disease, the bone will grow back naturally, and we don't have to extract the tooth. One key element is if your teeth are not loose, they often can be saved. So even though the periodontal disease is advanced, you're probing 10 or 12 millimeter pockets and say, this is horrible, you're never going to be able to save that tooth. The answer is those 10 or 12 millimeter pockets are very capable of regeneration.
Wow.
If you get to them and get to them in the right way.
So if we go back to our original topic and say, well, why shouldn't we do dental implants? What are the factors that we want to consider actually? So if we just back away from just the foregone conclusion, what are the factors? How do we, as owners of our own mouth, how do we appropriately decide or get the right help in deciding what our next step should be?
Well, I think once you've gone through all of the things you're going through with the general dentist, and the general dentist said, I've tried as much as I can, we can't save the tooth. I think at that point you ask for a referral to a specialist. So if in fact the root canal is closed down and the dentist can't get into the root canal, it's, can I go to an endodontist? And can you refer me to an endodontist? And if you're not referred to an endodontist, refer yourself to an endodontist and let the endodontist examine you. If the patient has periodontal disease, and they've been going after with the hygienist, the pockets keep on going from 5 to 6 to 7 to 8, and you're still not getting any progress, gums are bleeding, bad breath, all of those types of things, then ask for referral to a periodontist or find a periodontist yourself. Those are the two specialties that are involved with saving teeth.
That was a question we'd actually written down, the two specialties. Now, again, if we describe it just so those of us like me that don't understand the difference, explain the difference between what a periodontist does and what an endodontist does.
So if we look at a periodontist, the periodontist is responsible for the interface, or for the junction between the gum and the tooth. And that junction between the gum and the tooth is often bone, and it should be bone. If the root gets bacteria on it, that bone starts to go away. And that's what results in these pockets. So if we're working on the outside or around the tooth, that's peri. Peri in Latin means, I think it's Latin, not Greek. Yeah, I think peri means around the tooth. If we're working around the tooth, then we're going to the periodontist. If we're talking about things that are involved with decay and the nerve of the tooth, then we're talking about the endodontist.
Now, so there's actually many levels to somebody saying, well, I think I want dental implants. One is maybe just I'm just imagining one could be going through a lot of pain and just wanting to get out of pain. Another might be strictly, well, cosmetically, I just want things to really be viewed the right way. And how much of those decisions fit in, or are there other considerations that go in when somebody's trying to say, what should I do?
There's also financial considerations. So even when we're looking at a patient, we're looking at our patients from both perspectives, saving teeth, extracting teeth and doing dental implants, finances also enter into it. So when we're doing that kind of a diagnosis and treatment plan, I'm saying, all right, if we do it this way, it's going to cost this amount. If we're doing this way, it's going to cost this amount. So that's in the big case where you're seeing all the extractions done. And and implants being put in. I think the other area that we're looking at is the individual tooth or a small group of teeth. Mm-hmm. Can they be treated? Or is it going to be so much treatment that's going to be unpredictable? After all, I'm saying a tooth can be saved. That means a root canal, periodontal treatment, build up a crown, and it's a lot of procedures to do on a tooth. It may be easier and more beneficial to do a dental implant. We've got to look at it from both perspectives to determine what's better. If a tooth is too weak, it may be better to extract the tooth and put in a dental implant. And that's what you're looking for from a good diagnostician to determine that.
And that was actually another question that we had sort of tagged out on was, what if your situation is your crowns are falling out or they're causing pain, and is that a good time to extract the tooth and move to a dental implant? Is that a solution for that?
It might be. It is a solution for that. But one solution that is often overlooked is the fact that we can lower the gum line on the tooth, remove a little bit of the bone from the tooth, have more of the tooth sticking out of the gum so that we can put a crown on that does stay. That's called the crown lengthening procedure.
So it seems like when you see like these national commercials, and it's kind of like they have one tool, it's this hammer, just like rip everything out and put everything in. What you're saying is there's a lot of subtlety and a lot of optional, well, maybe not optional is the right word, but there's a lot of considerations that you want to think about before you just say all or nothing.
I would think so, and I think if you're going to if you're going in there with a headlong saying this is the only treatment for me, you're going to find some place to get it, and you will find that. But if you're really looking for some thinking skills and going through the process, and you still might end up with that same treatment, then probably a periodontist is a better place to go.
I know you guys have also built a reputation. You've historically, you've done a lot of these dental implant seminars, and I remember attending one that you did a few years ago, and I remember walking in the door and I thought, you're going to tell me it's dental implants all the way, and it's just a sales pitch. And I have to say I was really amazed at how much I learned, because it wasn't that at all. You took the time to, first of all, explain what's going on. You certainly were able to present, yes, you can get the beautiful smile. Yes, you can do this. But you went into a lot of these things that we're talking about so that as people who attended, they walked away with a much better understanding, first of all, just what was going on with their dental health, but also the understanding that it really makes sense to sit down and come up with a customized plan for somebody based on everything that's going on for them.
It's true. We talk about Steve, and we talked about Steve that night, and Steve had walked in saying, I hear you do dental implants, take out these teeth, put the dental implants in. And I looked at Steve and I said, you don't need dental implants. We can use your existing teeth as dental implants, and we'll give you a beautiful smile. And we did. So it is diagnosis first. And I don't care whether it's medicine or dentistry, it should be diagnostics first, and really get a good sense. Sometimes we feel that we may be overwhelmed, that it's over our heads to be able to understand this. Frankly, it's over my head to be able to understand an engine. But still, if I needed an engine replacement, I'd want to understand why before I actually got the engine replaced. Perhaps maybe I just need a tune-up. If there's such a thing as spark plugs anymore, there probably aren't. Maybe there are other ways of going about it. And I think the same way as you're looking at any specialty, not just in medicine or dentistry, you can look at that.
Yeah, and you guys have also expanded over the years. I'm talking about in terms of the dental practice, which is, interestingly enough, you've coined the phrase solid bite dental, which, maybe people might first think, well, that's dental implants, but I think what you're talking about as a periodontist is making sure that people do have however you work it out, so that they can enjoy the process of eating and not feeling pain in their mouth and all of that.
It's true. I mean, there are two main reasons that people see a dentist. They want to smile and they want to chew. And usually smile is ahead of chew for most of our patients. And yes, we need to look at the end result that you want first, and then what are the steps we need to do to get there. And there are a number of different ways of going about the same to get the same result.
So, and what I was starting to say is, originally you were a periodontal practice, but now actually you've actually expanded because your son, who's been named one of the top 40 dentists under 40 in America, which is pretty prestigious, I would think.
I'm a proud papa.
But you really, at that level, you've really...
But then again, I had to beat him up for a long time for him to get there, so I take some of that credit.
I think you deserve it. But, I was thinking about this because it really puts you in a unique position to really offer solid advice on the best steps or best possibilities. And I guess it is, like you said, not one path always fits all needs. You're going to sit down with a patient and you have that ability from everything from routine, maintenance and things that are going on to somebody who says, no, I really am serious. I want to get that best smile. Or really, I'm having pain and I've got to get out of the pain. It looks like you're able to really operate on that continuum.
It is, and the neat thing is that my assistants understand exactly what I'm saying, so I might go blah, 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 and then the assistant is spending now an hour and a half to say, this is what he said was.
Yeah.
I try to give the patient a good overview as to what's going on, but really, for the patient to really appreciate it, you need to have a staff that understands what we're talking about as well.
Yeah, and by the way, speaking of all these great television shows that are really full-packed information, I remember you and Joe did a show specifically about the value of the medical office team and how important that is, that it's not just the skill of the dentist, but it's how everybody in the office works together to take care of the patient.
It's true, and I think that's probably, you talked about my level of expertise, probably the reason we have a consulting group, a national consulting group, is because of Danielle and how Danielle has coordinated that team, and how we pick that team and how we train that team to be able to deliver the services that we want.
Well, it's an interesting discussion today. We're just about out of time. I don't want to leave without giving the phone number and how people get in touch with Solid Bite Dental, Dr. Lee Sheldon, Dr. Michelle Furtado, and Dr. Matt Sheldon. Together, you guys are like a triple team that really can provide some good answers and good insight. How do people get in touch with you?
So they can call us at 321-259-8000, or they can go to www.solidbite.com and they can look us up there.
All right. So in a closing moment, I guess, how would you sum up what we talked about today? We started sort of with the negative side of it. Why shouldn't you do dental implants? How do we wrap this all up with a bow?
I think when you're told to do something, then when you're told to do something, take a deep breath and decide whether you might want to get a second opinion first, which goes back to a previous show we've done, and see what a specialist can offer you before taking that leap that you may not have to take.
Great advice. And thank you, viewer, for joining us. Thank you, Dr. Sheldon, for joining us for Helping Seniors TV on today. On behalf of Joe Steckler, our president and founder, and the whole Helping Seniors team, we thank you for joining us and hope that you have a marvelous day. And check out the great shows on Helping Seniors of Brevard.org.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.